Hello, everyone. This is Nicole Broughton, Director of ABA Services at the American Autism and Rehabilitation Center, and this is ABA 101. During this presentation, we will discuss what is ABA and why is it effective with individuals with ASD, what and how do ABA therapists teach, and common questions about ABA therapy. Applied behavior analysis is a field of psychology that applies a scientific approach to the study of behavior. It was introduced by B.F. Skinner, who researched the way that circumstances in our environment play a role in prompting certain behaviors and reduce the likelihood of other behaviors. The goal of ABA is to use the basic principles of behavior to bring about a change to socially significant behaviors that are meaningful for the client and those in their environment. What makes ABA effective? All techniques used by behavior analysts are grounded in research that supports its effectiveness. ABA therapy develops individualized treatment packages. The behavior analyst will observe each individual client, assess their current skill sets and those that need to be developed, the resources available to them, and their environmental setup. The behavior analyst will then design a treatment package that will be most effective for that client. Once the treatment package is implemented, data will be collected continuously on the client's behavior and progress towards goals. Data collection allows the analyst to monitor client progress and allows them to make changes to the treatment packages in real time. Treatment is continuously altered as needed. Parent involvement is also required. Parents and other caregivers are also trained to implement treatment techniques to ensure that their effects are maintained even after sessions have ended. This helps facilitate the continuation of treatment's effects, as well as generalization to a variety of settings. ABA and teaching new skills. Your behavior analyst will consult with you about what you want to focus on with your child. Most often, a behavior analyst will talk with you, ask you to complete forms and questionnaires, and observe you and your child in everyday routines. Depending on your child's age, a behavior analyst may focus on a wider variety of basic skills or functional skills. A behavior analyst will then prioritize these behaviors based on what is most important and then develop long and short-term goals. Examples of goals include development of motor skills, such as using utensils and handwriting, communication skills, developing vocal speech or the use of communication devices, functional skills, potty training, bathing, cooking, dressing, or using money, academic skills. Setting academic goals typically begins by focusing on component skills necessary for the larger subject. Social skills, which include small talk, sharing, group play, how to respond to certain situations, and what emotions are. ABA will also focus on behavior reduction. The behavior analyst will observe unwanted behaviors and identify when environmental cue is maintaining the behavior and which environmental factors are preventing desired behaviors from occurring. Environmental cues that maintain a behavior are known as a behavior's consequence, or what occurs immediately after a behavior. A consequence that results in the behavior occurring again and again is known as a reinforcer. When problem behaviors occur often, a behavior analyst will observe that behavior to determine what is acting as that behavior's reinforcer. A behavior usually occurs for 4 reasons: attention, engaging in a behavior to receive attention from those in the environment; escape, engaging in the behavior in order to get out of doing something he or she does not want to do; access, engaging in the behavior in order to get a preferred item or activity; and automatic, engaging in the behavior because it creates a favorable outcome without the involvement of another person. Once the behavior analyst has identified the potential main consequence, then an intervention package will be developed. Intervention packages include, but are not limited to, no longer providing the reinforcer for that behavior, providing the specific reinforcer for a more appropriate behavior, or providing a less desirable consequence. It must be noted that this one is only used when a behavior is extremely severe or when no other interventions have been deemed effective. How we teach. Behavior analysts use a variety of ABA procedures, some which are directed by the instruction and others which are directed by the individual. The individual will have many opportunities to learn and practice skills each day in planned and naturally occurring settings. The individual will receive an abundance of reinforcement for demonstrating useful skills and socially appropriate behaviors. Techniques that you will see during an ABA therapy session include discrete trial training, a highly structured one-on-one teaching environment in which tasks are broken down and taught in small increments, natural environment training, learner-led, and focuses on the motivation of the learner to teach skills, pivotal response training, which looks at things that are pivotal to the child's behavior, what motivates their behavior, how they respond or don't respond to social interaction, and how the individual manages or does not manage their own feelings and behavior. And lastly, verbal behavior, which teaches communication and language learning by connecting words with their purpose. Who provides ABA services? A board-certified behavior analysis provides ABA therapy services and will be the one developing treatment plans. In order to become a BCBA, you need a master's degree or PhD in psychology or behavior analysis. You must pass a national certification exam and seek a state license to practice in some states. You can also have a board certified assistant behavior analysis provide ABA therapy services. To become a BCABA, you need the following: a bachelor's degree, you must pass a national certification exam, seek a state license to practice in some states. BCABAs are trained and supervised by the BCBA. ABA therapy also involves therapists or registered behavior technicians. These are therapists that are trained and supervised by a BCBA or a BCABA. RBTs work directly with the individuals to practice skills and work toward the individual goals written by the BCBA. Will ABA work with other therapies and fields? ABA therapists will collaborate with other therapists, such as occupational, speech, and physical therapies. It is important for you to provide a team approach for your child. While ABA uses evidence-based procedures, we want you to understand that you are a parent and make the overall decisions for your child. When it comes to experimental decisions, we ask that parents let us know of any changes so that we can monitor the changes in behavior. This allows the BCBA to help the parent know if the experimental decision has made a meaningful change in their child's behavior. Will ABA therapy only use food as reinforcement? Reinforcers are any item that, when presented after the behavior, result in that behavior occurring more often in the future. The strength of that chosen reinforcer will determine if the individual will or will not engage in the target behavior. The decision to use food as a reinforcer is dependent on the child. Please know that when an ABA treatment plan begins, there will be heavy levels of reinforcement. But over time, the reinforcement will fade and other reinforcers will be used. If you would like food to not be used as reinforcement for your child, please let the BCBA know during the evaluation. How many hours of ABA therapy is recommended for progress? Studies have shown that ABA treatment plans are most effective when the individual receives 20 to 30 hours of ABA therapy a week. Although 20 to 30 hours per week is the recommended amount of time, BCBAs will work with your schedule to the best of our ability. A personal goal for me as a behavior analyst is to decrease the hours once consistent progress is documented. I will make recommendations to slowly integrate your children back into non-contrived environments as the behavior team seems fit and provide all necessary supports as we make this transition. If ABA techniques do not seem to be working, how and when can we adjust the treatment package? Behavior analysts will take constant data on behavior and goals of the client. His or her behavior team will meet weekly to discuss progress or the lack thereof. Parent trainings will also be completed monthly to discuss the progress of the client. Following consultation with all of the above mentioned variables, changes will be made that best suit the client. Treatment packages will be modified immediately following reports of self injurious, physical aggressive, or any other behaviors that may cause harm to the client or others. What input do parents have in developing treatment packages, and how involved can a parent be in a therapy session? Interviews and questionnaires are completed during the intake process for ABA therapy. Information gathered during this time will serve as a blueprint for the development of your child's treatment package. Goals will be developed based on your input and will be implemented based on priority. Independent skills, such as potty training services, serve as priority over certain skills. And a parent can be as involved as they choose. I would like to thank you all in showing your interest in ABA therapy and our services. And if you have any other questions, please feel free to email me at NicoleW at American Autism and Rehabilitation Center. Thank you.